Welcome back. Well, we have a great guest on today. Her name is Lauren Simpson. She is not only a Breastlink patient or former patient, she is now one of their volunteers. Nice to have you on the show today.
Thank
Welcome.
you very much. Thank you.
And your experience, how long ago did you go through this, where you had your breast cancer diagnosis and then the treatment plan, and how was the experience overall with Breastlink?
Well, I was diagnosed a year and a half ago.
Okay.
I'm a year and a half survivor now. And it was actually a fluke how it was discovered. I've been having mammograms for about 25 years. I'm currently 65 years old. And they've always been negative, or, normal, but
Right.
I have dense breasts. And my mother had breast cancer, but later in life. So in 2013, I had my normal mammogram done. It was negative, and to my surprise, I was having a follow-up ultrasound done because the year before they had found some scar tissue. So I was having the follow-up ultrasound, and on the other breast, the radiologist thought she saw something suspicious. So she had me go for a 3D mammogram, and then she suggested that we do a biopsy, which was scheduled 2 weeks after that. And after the biopsy, she told me I'd get the results in about 5 to 7 days, but I go with that old adage, bad news travels fast, because I got a call in 3 days, and I was told I had invasive lobular cancer. So I was quite surprised. I was given different names of doctors, and I chose John West of Breastlink to go to, and I chose to have a bilateral nipple-sparing mastectomy.
Okay.
I had different options available, but that's the one that I chose to have done.
Okay, and how about overall the experience that you had with Breastlink and the information about, that you could give just about Breastlink? Obviously, you had a wonderful experience.
Yes, I did.
Is a great outcome, I should say.
Right.
And because you're with them now, you're helping out others, right?
Right. Well, Breastlink is an all-inclusive center, and I felt so comfortable when I was first there. I had a support service advocate in my meeting of my diagnosis with Dr. West. I was told that there was a tumor board which would discuss my case. So you're not just getting one opinion, you're getting multitude of opinions as your case is presented, to choose what they would feel would be the best turnout for me. And I was also impressed with the fact that they have clinical research trials that are ongoing. I think they have about 19 of them, although I'm not a part of one. And they also had the support services, which I found very helpful. So,
and that's one of the things. And they also have support services. They help out with friends and family. I mean, all this becomes part of it. It's a whole sort of a collection of folks that become involved, and they help these people get involved and understand.
That's right. Your doctors become your friends. Your friends are still your friends, and your friends and family are very important. I think the most important things that they can do for a woman that's diagnosed is to be a good listener, to be supportive, not judgmental about the decision that they make, and also to be comforting, because the woman is given so much information. It's difficult to process, and we all go through an array of emotions, the fear, some anger, what's going to happen. So being that listener and being supportive is just so important.
And now you're on the other side of that.
Yes, I am.
You are with their volunteer program for newly diagnosed women and when they're just beginning to undergo treatment. Tell me about that program. Why did you take that step into doing that?
I knew almost from the beginning, from my first appointment, when the volunteer was sitting there with me. I have a great sense of humor. I think that helps me through. any adversity I may deal with, and I've been through quite a bit in my lifetime. I just knew that I could be beneficial to other people. I'm basically a very happy person, and I am happy to share with others my experience and my knowledge, and that feeds me back in turn. But I find that other patients are very receptive to me, speaking from the heart. I have the experience, I've been through it, and I can give confidence to them.
Yeah.
So I just love the program. I love being a part of it, and I hope to do it for a long time.
And when you do this program, how often do you meet with other women? Is it just as needed?
Well, I do a few things. One is I go in on Mondays, that's my day, and I sit in with any newly diagnosed women with their doctor.
Oh, okay.
And then I will help give them information. I give them a packet with information about breast cancer, nutrition. I answer any questions that they feel comfortable asking me that perhaps they didn't feel comfortable asking the doctor.
Yeah, and that's understandable.
Yes, and then I also do phone calls. I will follow up with somebody that I've been assigned, maybe is around the same age as myself, has been diagnosed with the same kind of cancer, is similar experience, and I was paired with someone. So when I went through it, I had a mentor who I could call, and I did call when I was feeling low or I had questions, and she'd call me in turn and help me along the way, and that's what I do now as well. And I'm also helping them with fundraising situations as well.
So great program, definitely.
Wonderful.
And I think one of the advantages of their program there, or Breastlink in general, and I'm sure you can attest to this, is you have kind of everything you need under one roof, so to speak, to put it in very simplistic terms.
Yes.
But quite often, people who may go through this, and they have to drive over here and go over here to see this specialist and that specialist.
Right.
We're here, everything from having someone like yourself there, a volunteer, all the way up to, of course, surgery, oncology, and everything in between, right?
That's right. It's hard when you have to make appointments and go. You hear the news in one place, and then you call to go here, and then you have to go somewhere else for radiology. The thing about Breastlink is it's all under one roof. You have your surgeon, you have the radiologist, you have your pathological radiologists, you have reconstructive surgeons, and you have oncologists. And they have a tumor board every Friday.
Yeah.
And when a new patient comes in, they're discussing you. It's like having 10 different opinions right there. And then they discuss the situation. They come up with some options and treatment plans, and then that's presented to the patient. And when the patient is making their decision, hopefully they have all the information available. They've asked a lot of questions. They've done their research. I know that on the day that I was diagnosed, I not only saw my surgeon, but I also saw a reconstructive surgeon on the same day.
Yeah.
So I had a good idea about what options I had available.
Right.
And then after that, I saw the oncologist and had that game plan set in place. And the other thing is that a patient is given a back number. In other words, you don't call and have to listen through recordings.
Yes.
You can get to a number, and if you have to get in touch with a doctor, you can get in touch fairly quickly.
You're right.
And the other thing about support services is that if you do have trouble getting through to a doctor, call support services, because we many times can, maneuver the system and get some answers for the person as well.
Very good.
Yeah.
Well, obviously your experience has turned out very good, which is wonderful. And the fact that you're with their volunteer program and helping others along the way, I think that's fantastic.
Thank you very much.
It's a pleasure to meet you.
Thank
Definitely.
you.
Lauren Simpson. She is part of their volunteer program and former patient, I guess.
No, I'm still a patient.
You're still a patient,
oh, absolutely.
Okay.
They follow me very closely.
All right. With Breastlink, and over here in Laguna Hills, their number is 770-0797. We'll be right back. So you're still on your...